Hi, you are here right now because you or someone that you know has had a problem with their hip and maybe need a hip replacement, or they have a torn labrum and they need surgery. I had a torn labrum in my right hip, and I am having what they call a hip arthroscopy, or to repair a damaged labrum. So this video is about my journey and my journey alone. And I hope that someone, you or someone else that you know, may get something out of this, because I certainly got a lot out of the YouTube videos that I watched that helped me sort of calm me down and kind of give me an idea of what was going to happen. So hopefully you can get something out of this. I hope you do. So here's my journey on my hip arthroscopy surgery, and it was interesting. Thanks. It's about 10:30 and I am checking in with Jody, and I'm excited. My wife's not that excited, but I am. My surgery scheduled for sometimes after 10:30, so we'll see what happens, but I'll keep you posted as to what's going on. I'm excited. I'm have all checked in, taking my vitals, asking a couple of questions. And my wife is here to help me out, because I'll be out of it, I'm sure, after this is over. But I'm still excited, looking forward to getting this over with. And if you are interested in more, just stay tuned. I just saw the doctor. I just saw the OR nurse. I just saw the pain management nurse. And the next person I'll see is the anesthesiologist, and he's going to go over a lot of things with me. They're going to give me a pain block in my hip to help alleviate some of the pain after the surgery. And I think that's about it for right now. I'm just waiting. I'm all set to go. I probably won't have this smile on my face when you see me again, but hey, who knows?
Is that Jackie? Oh, Jackie. You got a funny one here.
I know.
She has a bit with me.
You're like...
I am in post-op, and I'm in a little bit of pain, but not a lot. The nurses were great, and I feel a little bit sleepy. My hip is numb. I have a brace on for my hip. And I'm assuming the surgery went well. Did Dr. Clark talk to you?
Yes.
Okay, so I guess I'm in recovery, and I'm assuming that the surgery went well. But I'm ready to get out of here and go home right now. So this is part of the deal. I right now I feel I'm not in a lot of pain, but they're going to give me oxy. Ooh, they're going to give me oxy. So I hope I'm not on oxy too long, but I think it'll help get me home. I live about 45 minutes from here. So on to post-op. So I will give you more later. Thank you. And here is the brace that they put on me. It's a big brace with ice. And I do have the water machine, so I think that's going to be a big help. And here is Miss
Marin.
Maryland?
Marion.
Marion.
Yeah.
Marion.
Got you some apple juice.
I just left the hospital, just left the recovery room, and I'm stopping at the drugstore to get some, they're gonna prescribe me Percocet. And everything went well. I'm feeling pretty good. It's about 3 hours since I entered the hospital this morning. And I'm doing pretty good so far. I have on a brace. You probably can't see this brace, but it's a big brace that they put on my leg. And to steady my leg, steady my hip. I don't know if you can see that, but anyway, the surgery was only 45 minutes, and the doctor said that it went well. Great care at the hospital. Kudos out to Intermountain Health here in Utah. And I'm just waiting. I have a little sore throat since they intubated me. A little breathing tube, but it went quick. Like I said, the salary. I must be a little loopy. The surgery went well for 45 minutes. So I have a 45-minute ride home. They did give me some oxycodone to get me home, and they prescribed, like I said, Percocet for the rest of the next few days. I'm hoping that I'm not on this pain medicine too long. They did give me a pain block, which lasts about 20 hours to help with the pain. That's pretty cool. So it went well. I'm happy. Looking forward to the recovery. Also, they did not prescribe me PT, which I was a little bit shocked. I was just knew that I had to go to PT, but the doctor scratched PT out. He said he doesn't need PT. So I'm not sure what I'm supposed to do. I got to follow up in 2 weeks. So we'll see. I guess I'll just take it easy. They did give me some crutches. I have a walker at home, and the most important thing that they gave me was the polar ice pack. If you don't have one, either your doctor will prescribe you one, or you can go out and purchase one. I was fortunate enough to have one provided to me by my insurance, allowed me to get one. So from what I understand, those polar ice machines are the best. So anyway, we're gonna get this medication, and we're gonna head on home, and I'll pick it up from there. Take care. See you in the next one. Well, I'm home. I use crutches to get in the house. Luckily, we don't have stairs, any of that. I feel a little woozy, just a little bit. I'm sure it's from the oxy. I did eat a Snickers bar while we were waiting at the drugstore. So I'm in my recliner right now, as you may see, and hopefully I can get some rest. I do have to put the polar ice machine on as soon as my wife gets situated, but I'm home, I'm alert. It was a 45-minute ride, but I didn't go to sleep, so we'll see. Right now, I just want to relax and watch TV and get this ice pack thing going. But it was a good experience. It was much anticipated, and I'm using my crutches pretty good. The surgery was a partially torn labrum in my hip. So The doctor said it was a good surgery. And here's the thing. I was thinking that I'm going to need PT. The doctor didn't prescribe PT for me. I don't know if that's because he doesn't think that I need it, or I'm guessing that's what it is. But he was on his checklist, and when he got down to physical therapy, he just scratched it all out. So I guess it's going to be trial and error. And he said basically let the pain be my guide as to my movement, my actions, and things around the house. So I can't shower for 2 to 3 days. And that was one other thing. I can't. No weight bearing, obviously, on my surgical side. So right now, I'm just happy to be home. A lot of anxiety, not really anxiety, but just anticipation. So all that's over now, and I'm home, and basically I should be losing the crutches in 2 to 3 days. So today is day 1 post-op, and I will give you another update maybe tomorrow or maybe in 2 or 3 days. But an update is coming. So thanks for watching, and I hope some of this helps you in your journey toward partially torn hip labrum surgery. And we'll just see how it goes. Thanks. Hey, tonight it's been 8 hours post-op, and I'm feeling pretty good. I did have some nauseousness first 2 or 3 hours, but I was able to eat and I kept it down on my stomach. Sometimes that stuff can make you really sick, but I ate. I had some soup. My wife cooked me some chicken noodle soup, and I haven't felt really any pain yet. They did give me a hydrocortisone right after surgery, and I think that's what made me nauseous. But they put me on 2 baby aspirins, 1 baby aspirin twice a day, and I'm feeling pretty good. I'm getting ready to go to bed. As you can see, I think this may be new, this brace. I do have the polar ice machine going. It's over here, and that has the water flowing in my through my hip, and they put the brace over that. And the nurses were saying this is relatively new to them anyway, and so I think it keeps my hip in place from flexing. But it's going to be interesting to see how I sleep with this tonight on. It's not too uncomfortable, but I'll run the ice water tonight along with that. I'm trying not to take a pill yet, another pain pill yet, but I'm sure either in the middle of the night or tomorrow I'll need a pain pill, but I'm trying not to do that. And I'm hoping this, between the brace and the polar ice machine that's flowing water through around my hip, I hope I'm going to try to keep the pain pills to a minimum, because I don't want to get hooked on those things and depend on them. But we'll see. I have a high tolerance for pain, so we'll see. But I'm going to close it out today and see what happens to tonight and tomorrow. And I'll let you know. I'll probably check up with you on Wednesday, if not sooner. Thanks. Peace. Hey there. Today's day 2 post-op. And today is the first day I've taken my brace off. This brace was on my leg to keep my movement to a minimum. This is a nice brace. It keeps me from doing this with this leg. This brace also has a water pad that runs ice water through here, through a pump, which I'll show you at another video. But today's day 2. I haven't taken but one oxy. Took that oxy from the hospital, and since then I've been taking just ibuprofen, which is pretty good. I haven't had any serious pain, which is great. Here's the bandage, as you can see. That bandage comes off tomorrow, which will be day 3 post-op. And the only problem that I've had so far really is just getting comfortable where I sleep, or how I sleep, I should say. And other than that, just finding that comfort position that's comfortable for you without causing any kind of pain. So again, I'm taking the brace off because it was just a pain in the you know what. But I need to put it back on, so I can't move my leg until I put the brace back on. And my wife's been really helpful adjusting this thing and keeping it tight and keeping it in place. But it's been good. It's been good. Tomorrow I will show you the taking off of the bandage and what it looks like after the bandage comes off. So I still have to wear this brace until my post-op appointment, which is about 2 weeks out from my original surgery. So I'll show you that. But this is a monster brace, but it holds my leg in place. It keeps me from jerking it or moving it up and down. But I'm doing good. I feel good. I haven't. The only time I was a little bit nauseous is when I took that oxy from the hospital. But that let me know right there that that's not for me. But everybody's pain level will be different. So this is just my story, my journey, and it's pretty good. Again, day 2, and feeling pretty good. So a little sore. You can feel the soreness. But it's not an acute pain. It's not throbbing or anything. It's just kind of dull, but it's not even a real harsh pain. It's just kind of there. And so I figured if I didn't take the oxy 2 days in, I'm not taking it anymore. But again, my surgery was really quick. It was 45 minutes, and so that tells me that it wasn't too invasive. And there wasn't a lot of damage, but I'm just happy here at day 2 post-op. So more later. So today is day 4, and I am going to take my bandage off of my surgery. So let's see how this goes. Ouch! Yeah, that hurts. Oh, that hurts. Oh. Bandages. More bandages. There it is.
It'll stay.
So, we'll see. I get to take a shower today, so I'm supposed to leave this on until I get to my till I see the doctor, which is about a week or so from today. Wow. See, these aren't supposed to come off.
They might.
So, don't know. But anyway, there it is. Two incisions, one here and one there. So, all right, we'll see. I'm going to go take my first shower today, so I'm excited. Thank you. And this is what it looks like up close and personal. So, we'll see. Thanks. Today is the 1st of September, believe it or not. And it's been 1 week for me. I had this surgery a week ago, yesterday actually. And I wanted to kind of give you a summary of where I was after 1 week of arthroscopy, hip arthroscopy for a labral tear that I had in my right hip. It's been good. I've seen some almost horror video, not horror, I shouldn't say that. I've seen some videos where people were really struggling that first week. They had a lot of pain. They couldn't hardly move. They were taking a lot of meds. And so let's start. Let me recap really quick. I had the surgery, the hip arthroscopy a week ago, and they gave me a oxycodone for pain when I left the operating room or the hospital. They also gave me what they call a pain block, where they go in and do a ultrasound and determine where the pain is, and I'm assuming they inject you at that spot, and that injection lasts for about 24 hours. So, having said all that, I took one oxy, and I was asked to take some baby aspirins for blood clots, for not moving, just kind of sedentary. So I have not taken any pain meds since I left the hospital, and I haven't needed the pain meds so far. It's been a week, and I am on crutches, as you probably already know. I'm on crutches, and I'm wearing this brace. And here you can see the brace in its full entirety. It can restrict your movement if you like, or it basically stabilize you in a certain position. And this has degrees on it, so you can move, maybe 5 degrees, 10 degrees, 20 degrees on that, depending on how you progress. So it's a little bit bulky, and the great part about it is that it has this bladder inside of it that you connect to an ice machine. It's the Polar Ice Machine by Berg, B-R-E-G, I believe. Lifesaver. You fill that up, you put it on, connect it to your ice machine. Man, you got some really cold water running across your surgical area. And man, let me tell you, I think personally, I think that's been the pain meds for me, having that ice machine, that Polar Ice Machine. It's been great. So I have that, and obviously I've had the crutches, which I'm still on the crutches because the doctor asked me to stay on the crutches, wear the brace until my post-op. Now my post-op isn't until Tuesday, which is about 4 days from now, the day after Labor Day. So I'll find out then how long I need the crutches, if I need to continue wearing the crutches. Right now, speaking of the crutches, without thinking, I've jumped up and started walking across the room. My wife said, "What are you doing?" I said, because I felt pretty good. I didn't hurt anything. I didn't hurt afterwards, but I was walking across the room, and I have a pretty good sized living room. Walking across the room, and I got halfway, I froze because I said, "Oh, I don't have my crutches." But I limped back to my easy chair, and it was fine. But yeah, so those are two things that I've used. Also, I've taken 3 showers. Yay me! And that was great. And here is a picture of my shower chair. Don't laugh. But this thing has been golden, especially when you can't stand on. I couldn't stand on one foot without maybe hurting myself. So it was nice to sit down, shower, and but it's been a great tool. So you might need one of those. Also, and I'm embarrassed to say, not really, this stool here that you see, you may laugh, but you know what? That thing is handy. it's really handy. And because you really can't bend too much, so you're able to sit down, number one or number two, sit down and hang on and keep your legs sort of stretched out, because it's hard to, you can't hardly I can't lift my knee, upward. So it allows me to be comfortable and do what I need to do, and then move on with my crutches. So that's been good. So I have some things that I may want to say here. So where am I now? I don't have any pain unless I do something crazy, like turn the wrong way, or move my foot or leg the wrong way, and I try to lift it up while I'm in bed. I try to lift it up, like that might sting a little bit. But otherwise, just generally speaking, I haven't had a whole lot of pain. So which I'm grateful for that. I guess I'm one of the fortunate ones, because I've seen some of the YouTubers that have some severe pain, and they take oxy or some type of pain med for a few days, and I haven't had to do that. So I'm very thankful for that. I'm able to get around the house on the crutches. Someone asked, don't you get bored, just sitting around the house all day? No, I don't, because I have other things to do. I'm a drone pilot, so I fly several drones. I do that part-time. I am a videographer, so that keeps me busy on the computer, and there's a lot of creativity going, and so I'm keeping my mind occupied, and walking. I walk across the house, 10 times a day, just to keep moving. But so I don't get bored. I showed you the equipment in the shower. The most difficult thing for me, I would say, has been the getting in and out of the car. And maybe I shouldn't have, but every time I get in and out of the car, man, I feel it, because there's no easy way when you've had hip surgery. There's no easy way to do that. So that has been my worst experience. It wasn't bad. It didn't kill me. I didn't go, oh my God, but I did feel it. So and that was the worst for me. So that's been good. That's been the most difficult thing for me. So like I said, I've showered. I'm moving around the house. I've even been in the kitchen, cooking or making snacks, or helping my wife cook breakfast. Which, by the way, you really need somebody to help you around the house as much as they can, because there are times when you may just not feel like getting up. You may not feel like moving. And it's hard to do things, you can't clean, you can't cook in the beginning. You can't do the little things, it's a struggle sometimes for a lot of people that first day getting to the toilet. So I have a post-op, like as I mentioned, a post-op appointment on Tuesday, and I am so excited because I'm hoping I can ditch the crutches and ditch the brace. Now, the bladder you can remove from the brace, as I'm showing you right now. You can remove the bladder from the brace and just put it on your hip, and just you can lock it down, because the brace comes with some straps that you can strap it in, and you don't have to wear the brace unless you're required to. I'm hoping my doctor releases me from the brace, but we'll see. But anyway, that's where I am after 1 week. Thanks for tuning in, and I'll give you another quick short when I go to see my post-op appointment next Tuesday. So until then, hey man, you know what to do. Thanks. Take care. Well, today is my 4th week, 30 days thereabout, and in summary, again, as you know, I had the hip arthroscopy, very minor. Was one of those 2.5-3 hour surgeries, but I'm doing really well. I am actually going to the fitness center today. I've been able to drive now for about, say about a week. So that's a big improvement. So this is my story. Again, it was very minor. A repair. It wasn't a huge deal. The surgery was 45 minutes, as you already know. But it's going well. I'm able to walk really well. I've dumped my crutches 2 weeks ago, and it's been good. I've done well, and I thank my doctor and all the nurses and staff at the hospital. Have been really well, and most of all, my wife, who's been a great help. Helping with the ice machine, having me get to the bathroom and take a shower, and she's drying me off. So she's been wonderful. So you do need that extra person if you're going to have a hip arthroscopy. So thank you for watching. I hope you got something out of this video, and we'll see you next time. Take care.